Hello.
How you doing?
How are you?
Good, thank you.
Yay.
Um, how are you doing today?
I'm doing okay. It's been
Yeah?
a little bit of a crazy day, but what's new?
Are you working today?
I feel like I'm working every day.
I hear
Uh,
that. Yeah.
yeah. How about you?
Today's my admin day, but there's a lot of admin stuff. So yeah,
Yeah,
I feel like I'm working every day too.
yeah.
Yeah.
It's all good.
Yeah. I'm really a lot of people sent in questions, so I'm really excited about our topic today.
Good. Well, I'm
But let me
excited.
just yeah. Sorry if I keep cutting you off. Can you hear me okay?
Yeah.
Perfect. So I was thinking I'd start with an introduction. All right. So
Good.
Dr. Rubin, say it again.
Sounds good.
Okay. So Dr. Rubin is a pediatrician and breastfeeding medicine specialist. She bucked the system in order to practice medicine in the way she believes is best. She opened a membership-based home visit practice in the western suburbs of Chicago. So she's close by, she's next door. And she provides general pediatrics services as well as breastfeeding consults and fourth trimester packages. Okay, she's thrilled to provide these services in patients' homes. That's what's so remarkable about this, especially where they need them the most. So, what an amazing bio and introduction. Thank you for giving me a little bit of your time today. I have a quick question. Can you tell me what fourth trimester is?
So fourth trimester, it is kind of a little bit of a new term. So if you think about pregnancy, and a lot of the focus is on this pregnant mom.
Mm,
And when the baby comes, the mom is no longer the focus, the baby is the focus. And this mom is going through a major life change,
mhm,
recovering from a major physical event, whether it's a vaginal delivery or C-section. There's recovery. She's exhausted. She's got this
mhm,
life to care for.
mhm,
And oftentimes the mom gets forgotten. And
mhm,
we are kind of terming this time, the fourth trimester, to remind people that this is a challenging time, both for moms and families, and the babies are going through rapid development and changes during this time too. So it's really a time when we have to remember as medical professionals to to give families and moms the support that they need to get through this time
mhm,
with grace and support. It's really all about
mhm,
support.
mm. So, fourth trimester is supporting the mom through the new experience of a newborn, caring for a newborn, and also caring for herself.
Essentially,
That's
yes.
how we would term fourth trimester. That's amazing. Um, I had a patient who kept being admitted back to the hospital after her delivery. And we kept wondering what was going on. And at the end of the day, she disclosed to us, she said, "Is there nobody that you can send home with me to help me?" Um, she came from the UK. She didn't have family here. And she was just like, "This is all new to me. We don't know what we're doing." She was just overwhelmed. And we would admit her for blood pressure, admit her for pain, admit it until we figured out that she just needed someone at home to
Yep.
help her, to help support her in that fourth trimester. That you've taken your baby home. It's sort of like kudos, but
Right.
having a provider, having a doctor whose job is to support you in your fourth trimester, I think is really remarkable. I commend you for exploring that part of pediatrics.
Thank you.
I know you said yes, go
I just
ahead.
want to think in particular in this country that's so important because other countries, not every country, but a lot of countries are better set up. And probably that person, if she's from the UK, I mean, the UK, I know Australia, I know France. I mean, people automatically, nurses come and do home visits
Mm,
after babies are born, which may be, kind of focused towards the baby, but still looking after how is mom doing. And, these are just things that do happen in this country, but it's few and far between.
Mm, mm. Yeah, I would say that you're the first physician I know of who would do home visits after a baby's born. I mean, it would be amazing if OBGYNs had that, OBGYNs like myself had that easy access next to us that would say, you can go to this pediatrician in a week. She'll come to your house to help you during that fourth trimester. I mean, I think that would create a network that would be so remarkable to support women as they experience it for the first time or, multiple times.
Right,
Yeah.
right. I mean, every time is different.
Yeah, every time is different. Every pregnancy is not the same. Right, right.
Yeah, yeah.
Yeah, and so you are in the west suburbs of Chicago. Which cities particularly?
So I personally am located in River Forest, and so I'm kind of in some vague perimeter around River Forest. So kind of near west suburbs, but also like I go out to LaGrange and Hinsdale
Mm,
area, Oak Brook, Elmhurst, west side of the city, and even the north side of the city I've been going to as well. Especially for the breastfeeding, I'm able to spread out a little bit further as well. So, and then can also do virtual visits for
mm,
specific issues, not for the memberships in pediatrics, but for the specific breastfeeding
mm.
consults.
That's amazing. I just love the fact that you go to their houses.
Yeah,
I think
I love
it makes a big difference.
Yeah, yeah, absolutely love it.
All
I
right.
don't always
Anything else you
know, but better me
Sorry, say
than
that
them.
again?
I don't always like trudging through the snow, but it's better me, than these moms with
Than
newborns.
them. Yeah, with their newborns. Right, right, right,
Right?
right. Anything else you'd like to add before we move on to the questions?
Nope, nope. I'm ready to play.
All right, for those just joining us, Dr. Cindy Rubin is a pediatric specialist and a breastfeeding medicine specialist. She goes to women's houses after they have their babies to help them with breastfeeding and also get through that initial stage of, getting home with the baby. So her specialty is really remarkable. And she's located in the western suburbs of Chicago. All right. I'll leave her information after our IG Live so that you can contact her if you need her services. All right, so we got some cool questions about breastfeeding that I want to ask you. So our number one question is, do you have to pump when you are exclusively breastfeeding?
It's a really good question. So it kind of depends on what your goals are and what your situation is. So most women, I would say no. Pumping is not necessarily an enjoyable activity. And breastfeeding is really, it works through supply and demand. So your body learns how much milk your body needs to make by how frequently, and how much your baby breastfeeds. So through direct nursing, those messages get sent both ways, and your body will learn to make the amount of milk that your baby needs. When, in an otherwise kind of normal situation where a baby is thriving and a mother maybe knows that she's going to be home for a period of time, or is a stay-at-home mom and will not be needing to work outside the home, there's really no reason to start pumping off the bat. It's better to kind of let things happen naturally, let your baby learn how to nurse, and let your body figure out via the baby how much is needed. Sometimes when people start pumping right away, they can potentially send themselves into an overproduction state, because let's say you nurse and then you pump after you nurse, then you're telling your body, oh, I need to make more, even more milk. And though having more milk than you need might sound good, it can have problems that come along with it, like discomfort, engorgement,
Engagement.
ducts, mastitis. So, in an otherwise, kind of working partnership between a mom and a baby where there's no problems identified by a physician and you don't need to be away from your baby, I would say no. There are certain situations where we do recommend pumping. And, we can talk about those if you'd like. But also another thing that sometimes moms think is that they need to pump in order to have a stash for when they do go back to work. And truly, you don't need to have a stash. So yeah, it's nice to have a little bit of milk, maybe in the freezer for those times when you do need to go out and you're going to be away briefly from your baby, or you want a date night with your partner, or, when you go back to work, you will need to pump at work and your baby will need to get pumped milk or formula, whatever you choose to do at that point when you go back to work. But really, all you need to have stored on that first day of work is the amount of milk that your baby's going to need on that day. And then while you're at work, you're going to pump, and that's what your baby will get the next day. So you don't need to have some big storage plan. And really, it just takes away time that you could have with your baby or sleeping or doing things that are enjoyable instead of being hooked up to the pump.
Mm-hmm. Oh, thank you for that. Because the more you pump, the more milk comes in. And so letting your baby determine what you need is best, because then you can avoid getting overfull and engorged, and that causes a lot of pain. We see women returning to the office complaining of engorgement. And so that's a great point for people to know, that let your body tell your baby. Let your baby tell your body how much milk your baby needs. That's awesome. Thank you for that. That answers the second question that says, how do you regulate your supply of breast milk? That answers the second question. Your baby regulates your supply. So please go ahead and speak to that.
Well, I was going to say, so that is exactly how it works. And there's two things that your body needs in order to make milk. So it needs the stimulation. So it needs time when your baby is suckling at your breast or that you're pumping and stimulating the nipple. It also needs frequent emptying of the breast. So every time your breast is emptied, you're telling your body, make more milk. So when we are trying to up our milk production for some reason, if for some reason your body is not making the amount that your baby needs, or let's say you have a baby in the NICU and you have to pump exclusively for that baby, and you're trying to get to the supply that baby's going to need when they are bigger, those are times when pumping more frequently or pumping in addition to nursing can help to increase supply by making sure that you're empty more frequently. If that makes sense.
Mm-hmm. Yes, that makes sense. Yeah. And so for women who maybe they didn't go home with their babies are in the NICU, they need to make more supply, they can pump, which is the suckling sensation, and then they can, and that also reminds the body to make more, because you're emptying your breast of what you've made.
Right.
Okay.
When your breasts are full, there's actually a feedback that goes to your brain and decreases the amount of prolactin. Prolactin is the hormone that helps your body to make milk. And so that hormone is suppressed when your breasts are full.
Wow.
So we want that when your baby's not hungry. So when your baby starts perhaps sleeping through the night, then your breasts are going to be full for a longer period of time, and your brain will get the message, oh, we don't need to make more milk right now at 2 a.m. because the baby's giving us the message, or the breasts are full. But let's say you woke up in the middle of the night to pump when your baby was sleeping, then your body would keep thinking that it needs to make milk during that time, which again, if you're trying to increase supply for some reason, that may be something that you want or need to do.
Mhm.
But generally, if you're making the amount that your baby needs, you can actually let your body make that adjustment to match what the baby's saying. I don't need the milk at 2 in the morning.
Mm. Oh, that's great info because that's something that I don't know that OBGYNs know specifically. I would usually just defer them to the nursery nurses. So it's a good thing that I'm getting this education also I can better advise my patients.
Good.
Um, yes. All right. So number 3, if your baby does not latch for long, what can you do to assist them?
So that's a really good question. So first of all, if your baby's not latching long, but your milk is in and your baby's been watched by the weight has been monitored and your baby's gaining weight fine, but your baby only latches for 5 minutes and then seems full, they actually may be full. So sometimes babies are very, very fast and efficient at getting all the milk that they need in a short period of
Mm.
time. But if we're talking about a young baby, a brand new baby, sometimes babies can be quite sleepy. They also get a lot of comfort at the breast, so can easily fall asleep at the breast. And especially if your baby was born small or a little premature, or sometimes, again, just simply a sleepy baby, um, may not eat as much as they need to. And so there are some tricks. So one is to um, first off kind of know what to look for to know whether your baby's eating well or being kind of pokey and sleepy. So a baby who's eating well, this might be more details than we need at the moment, and I can point people to videos that can kind of show this a
Okay.
little bit better. But a baby that's eating well will be swallowing frequently, essentially. Babies take breaks just like we do when we're eating. Um, but you know, I usually, if I'm eating, I'll take a few bites and then I'll take a break, take a few more bites, take a break, say something to my uh, co-eaters. um, but, and babies do the same thing. But some babies, if they're a little bit pokey and for whatever reason, it's harder for them to eat quickly, they will suck and then swallow, and every time they swallow they'll take a break, and that's going to take a long time to eat, and those babies may get tired out and finish and fall asleep before they're truly full. And so those are the kinds of things that you're going to be watching for, and it takes a little bit of experience, and that's where it's nice to have either a lactation consultant or an OB or a pediatrician or somebody who has some experience watch you feed your baby so that they can help you to see what those cues are, or those patterns are that can show you that your baby's eating well. So for the baby that is taking a break, let's say every single time they swallow, doing some compressions of the breast. I should have had my little breast model here, but some compressions of the breast, kind of gentle compressions while your baby is eating can help. It pushes a little bit of milk into their mouth. And so it reminds them to keep eating. And if they're just, don't have much stamina because maybe they were premature or something like that, it also does a little bit of the work for them. So it'll just often keep those slower babies a little on the breast, actually eating a little bit longer. So it'll help them to get more full at the breast.
Mhm. And I assume that you have videos on your YouTube channel showing people how to position their babies to latch.
Yeah, you know what? I actually haven't put that on yet, but
Oh,
that's coming up.
perfect. Because one of the issues I find that people are saying my baby's not latching, my baby is that they're not positioning the baby properly. And I've watched a few lactation consultants kind of tell them how to position the baby to get them to latch. And just like you showed, massaging the breast to release some of that milk into the baby's mouth can also direct the baby to remember to suckle and
Yes,
take milk.
exactly. And as much as we can do to have the baby initiate the latch, that usually
Mhm.
works better than us trying to kind of force it. And so it
Wonderful.
is important to kind of be patient. So as your baby comes up to your breast, you know, they may just sniff a little and lick a little and kind of figure out what's going on. And then suddenly they open their mouth and they're ready. And that's the time to kind of make sure that you're positioned in a way that's going to optimize that. But when we just kind of get our baby in position and kind of push the breast into the mouth, oftentimes that doesn't succeed because your baby just wasn't quite there yet and wasn't quite ready.
Mm.
So being patient and allowing it to happen on the baby's time. Another good one is having sometimes just laying down, reclining, and have your baby kind of face down on your belly, kind of in between your breasts, and letting your baby find their way to your breast. It's pretty amazing that babies do that. And it also puts a baby just in a comfortable position to get a nice deep latch. And that's something that's worth trying and is often something that we hope can happen in that first hour or so. That's why we talk about skin to skin after a baby's born. That's such an important bonding time, but it also is when babies often have that very first latch. And that very first latch is a setup for success thereafter. And it can't always happen, you know, whether if there's something going on with the mom or the baby, there are times when that takes precedence. But when possible, having that period of skin to skin and allowing your baby to naturally latch really does kind of imprint on your baby what they're going to do to eat from there on out.
Mm. And that takes us to the next question, which says, does skin to skin
Mhm.
affect or assist your supply? So
Yeah.
it looks like it's a yes based on what you've said so far.
So it definitely can help with latching. And I do recommend tons of skin to skin when babies are not latching for some reason. It's just that is an enjoyable time. It's a way for moms and babies to still bond, even if their baby's not eating well at the breast. But that skin to skin actually helps with the mom's production of those hormones that help produce the milk. And it can de-stress the mom too, that also helps with milk production. So skin to skin really can help not only with helping to get your baby to latch, but also with the actual milk production. And it helps later if there's problems with latching, but it also helps in that first hour. It truly does. In those first few hours, having that skin to skin time, both the latching as well as the skin to skin, it helps that whole process start going, for all of the things to happen that need your milk to start to increase.
Mm. And when you say that first hour, you mean that first hour after the baby's born?
Right, right.
So I know that this is one of the, it's a big policy in many hospitals, getting the baby on the mom's skin within the first hour of delivery, as long as the baby's healthy, so that the baby can, like you said, learn, find the breast, increase the chances that that baby will breastfeed, increase the chances that the mom will have a good milk supply. So that's a really remarkable thing that hospital systems are now implementing in especially on labor and delivery units. So that answers that question. I think you answered this question already too. Number 5, it says, would you advise new moms to begin pumping right away? when they're still in the hospital? And I think we addressed that with our first question, which is a no, right?
Right. Generally, the answer is no. There are some situations, certainly if you are separated from your baby for any reason, then it is really important to start pumping within those first kind of 6 to 8 hours.
Mm,
There are times when moms don't let the staff know, I really wanted to breastfeed, but I'm not around my baby. You need to make
mm,
sure you advocate for what your plans are and make it known so that you have a pump in your room and you can start doing that
mm,
right away. But if you're with your baby, and again, there's no reason to think that anything, everything looks like it's going well according to hospital staff. Your baby is latching and waking up every few hours to eat, then there's not necessarily a reason to. There are, like I said, some things that can make us a little bit more worried with milk production, or that you could be at risk for having some breastfeeding problems. And those are the times that sometimes we would recommend pumping right up front. And if that's the case, then so that's why sometimes having a prenatal consult with a lactation consultant or a breastfeeding medicine doctor can help you to know whether or not you may be at risk for having production issues, or if you know that you had those problems in the past, then you may be a mom that would be recommended to either pump or do some additional hand expression to express the milk in addition to what your baby's doing. But generally, if your baby's eating at the breast, just kind of let your baby run the show.
mm, mm. That prenatal consult, do you recommend it at any particular trimester or closer to delivery time? And that's something that you offer as well?
I do offer that. And I'm actually starting a kind of a package where I will provide for anybody in Illinois, if you're interested in having a prenatal consult with me and then another consult after the baby is born in the first week or so, to go over your medical history, the pregnancy, and talk about any risk factors and also just what to expect and a little bit more of this education on how to get a smooth start and then to troubleshoot any problems that may be happening over that first week. So that's a new package that I offer, and that's anywhere in Illinois because I am licensed in Illinois. But I do usually recommend a prenatal consult if it's going to happen between 34 and 36 weeks. Gestation is a good time to do it. Could be done sooner than that, but I think usually people aren't really thinking about it yet.
Right, right.
And then by 36 or 37, that baby might be coming soon. So, 34 to 36 weeks is a good time. Maybe earlier if you're having twins or you've had a premature baby in the past, just to talk about those kinds of things in case it happens sooner rather than later.
So that's an amazing package, because I don't know, and I don't want to speak out of turn. Like, I'll speak for myself. When I was doing obstetrics, we certainly did not. We were always talking about lactation consultants after the baby was born. When there were issues. So to be proactive and to have that conversation ahead of time, set expectations for the moms, because we would have frustrated moms who would say they're not getting their milk in, their baby's not latching, and then we would just say, oh, let me put a lactation consultation in for you. But having someone there who's an expert at it, walk you through expectations before you have your baby and help you within that first week, I think is a remarkable addition to prenatal care and postnatal care. And so I applaud you for your practice, for this innovation. I think I'm really, when I'm pregnant, I will be contacting you.
I'm here.
Because even as OBGYNs, we don't have these information. We don't know these things.
I mean, this is what I have discovered is so tough is that we don't get this education in medical school or residency. Even those of us, I'm a pediatrician, you're an OB-GYN, we're on the front lines with, new moms, and we don't get adequate training. And thankfully, we're starting to change that. And
Yeah.
those who are kind of specializing in breastfeeding medicine are working to not only educate those who are already out practicing, but to educate the next generation so that
Yeah, absolutely.
more information.
Yeah, it'll be great for the residents, the upcoming OBGYNs and pediatricians to have this as part of their curriculum so that they're coming out more experienced. Yeah, absolutely.
Right.
Absolutely. Our last question, it says, what foods or meals assist in increasing your supply of breast milk?
So that's a good question. So generally, eating just a well-balanced diet when you're lactating is important, and keeping yourself well hydrated, really drinking to thirst is the main goal. And having a little fly here. Having in general, we recommend, or a lactating woman needs about 500 additional calories a day to their normal caloric intake when they're lactating. So you can eat a little bit more, but again, well balanced diet, not really any different than something you would do probably we're doing when you're pregnant, or in general what we would recommend for a healthy lifestyle. On top of that, specifically to increase milk production, there are some herbs that can be helpful. So, and some of them you can find in your spice closet.
Local spice shops, or your own closet, or your own like little, in your house.
Right. Not all of them, but something like, actually, I guess we probably find more that hurt supply in our pantries than help. But probably you wouldn't be having them in large enough amounts to cause a problem. But traditionally, people talk about brewer's yeast and oatmeal and just fluids in general to increase production. And there's not really any great evidence for any of those things. Though I do think that, so brewer's yeast is in beer, and so a lot of people will drink a beer and really think that that helps. And I think it might help to just kind of decrease some of that stress that then leads to better production in moderation. Okay, we don't want to be drinking a ton of beer, but that's whole nother subject that we could go into. But a beer is okay. But I don't know that there's not really any great evidence to back it up. But a few herbs that are out there, that there is some evidence, if not great evidence in the books, years and years of anecdotal cultural evidence in different cultures that use these herbs. So goat's rue is one of them. Goat's rue is actually the herb that metformin is made out of, and metformin is a medication that is used for people with PCOS and type 2 diabetes. And so you don't want to use the two at the same time. That's important. But that is something that can be helpful. And then something called moringa, which I found this to be fascinating. I recommended it to a woman who was from the Philippines, and she said, oh my gosh, that's so interesting, because in the Philippines, all of the aunties, after you have a baby, make a soup made out of moringa and bring it to the new moms.
Oh, wow.
Oh, that's clearly somebody figured that out.
Something working.
Yeah. So those are the two that I generally recommend. I mean, there is a long list of other herbs. Um, but I would say if you're struggling, if you're really struggling with milk production for any reason, it's really good to reach out to a professional to get some more guidance on all the different things that you can do, not just
Mm,
in your diet or with herbs, but lots of different things that we can offer to help.
mm, mm. So, I wanted to go back a little bit to the beer situation because there's this idea that, no alcohol when you're breastfeeding. And if you do, you have to pump and dump. So you have to pump the milk out and then dump it. So when you say beer, you're just saying that for those with uh, issues with milk production, that is a possible option, or am I understanding that uh, incorrectly?
So I wouldn't really recommend drinking beer at
Right.
your protein cup. But I was just kind of uh, extrapolating that really
Mhm.
what's helping there is a little bit of
Mm.
stress
Is
relief.
the
If
was stress relief, right? It's to
right,
de-stress the mom.
is yeast. But in fact, there's really very few times that people really need to pump and dump in terms of
Mm,
both prescription medications as well as things um, like alcohol and caffeine. So
mm,
in large amounts, those things certainly can, do go through the breast milk and into your baby. But in moderation, these things actually can be safe.
mm,
And a drink, like having one drink, usually, especially if you time it, so, you nurse or pump and then have a drink, usually after about an hour, your body has metabolized that alcohol. And if you are feeling like you're not drunk, and you're able to hold your baby and take care of your baby at that point, then your body has metabolized that alcohol to the point where it would be safe for your baby to have the drink or have the have your milk. Don't give the baby the drink. Uh, but it's not like the alcohol goes in your mouth, goes through your body, and then lands itself in the breasts and is sitting there 3 hours later for your baby to drink in the milk. It's like when your
mm,
body has metabolized it in your blood and your brain is no longer getting that alcohol, then your milk isn't getting it either. It is
mm,
metabolized everywhere.
mm,
Um, and then caffeine is something that, again, in small amounts is probably perfectly fine. One, maybe 2 cups of coffee. But you may notice that your baby gets a little jittery or fussy or has a little bit of a reaction. And if so, then you probably would want to back off,
mm,
um, but probably safe in moderation.
mm, mm. Well, that's awesome. That's really, really good to know. As a coffee drinker, I was already wondering, would I have to give up coffee during that period of time? So it's good to know that, just like in life, everything in moderation.
Right.
And like you said, timing it such that by the time you're breastfeeding, that caffeine or that trace of alcohol has been cleared out of your body by your system. So only so most women don't really have to pump and dump, only in rare situations.
Right. And same with, again, with medications. Unfortunately, it's very difficult to get studies approved on pregnant women and on babies.
Mm.
Just ethically, it's hard to get that
Yeah,
research
it's hard.
approved
Yeah,
by the people who need to approve them. So we don't
yeah.
have a lot of data on a lot of medications in terms of actual studies. But we do
Mm.
have a lot of information and extrapolation that can go on based on either samples of milk from women who have needed to take certain medicines while breastfeeding or while pregnant, or looking at, for instance, the how big is a molecule of a medicine, and does it make sense that this molecule would even make it into the breast milk? So there are people who have really looked closely at that with pretty much all medicines that are out there, except maybe the newest ones. And there are some guidelines on whether or not you need to pump and dump, whether or not things are risky for the milk production or for your baby. And so if you, and again, there are very few medicines or situations where you truly do need to pump and dump. So if you are told that you need to, it's best to reach out to somebody who can look into that a little bit more for you, to see if that's truly the case, or, and if it is, then maybe there's an alternate medicine that you could take instead, if you really don't want to have to pump and dump. That's not always going to be the case. I mean, like chemotherapy, and there are some medications out there and situations where you absolutely won't be able to feed that milk to a baby. But for the most part, we actually don't need to.
Well, that's good to know. That's I'm sure that would be relieving for a lot of women. So the main things I got from today is that skin to skin within the first hour of birth, as long as your baby's doing well, that allows the baby to find your breast and kind of start the process of stimulating the brain to release the hormones that you need to bring your milk in. So letting the baby sort of start the process instead of forcing it. And then when your baby nurses, your baby tells your body how much milk your baby needs. So you don't have to be pumping and causing an oversupply, which can cause engorgement in the breast and possible infection in the breast called mastitis. So just kind of letting your baby dictate what your baby needs. You know, if your baby's premature in the NICU, you're separated from your baby, then pumping is necessary. But allowing your baby to tell you what milk you need. And there are some things you can do if you're having trouble with milk production. We talked about brewer's yeast. We talked about miringa. Is that what you called it? Miringa. And I think that's really awesome. You know, these, cultures have a lot of, like you said, anecdotal evidence, things they've tried and tested that have worked, that would really help with, milk production. So any other uncommon knowledge you want to share with us?
No, I think that was great. That
exhaustive.
Was a lot of good questions that you've got. I mean, there's definitely a lot more out there, so I'm happy to come back and go over at some point. And I'm also happy to, be a resource for any of your patients or anybody listening today.
Thank you. I really appreciate that. Yeah, for me too. Dr. Rubin, can you tell us your social media handles and your YouTube channel so that we can go watch some videos that you already put up and maybe even put a request for what we want to see on your page?
Absolutely. So my webpage is intouchpediatrics.com. And then on Facebook, I mean, you could just look up In Touch Pediatrics and Lactation. On Instagram, I'm at In Touch Peds. My YouTube channel, because it is very new, it just has this numeric long or crazy address. So we can put that in the comments. But but I think if you Google, I know people have just Googled In Touch Pediatrics and Lactation and have found that on YouTube as well. So those are the main me. But I have links on my website. So if you just go to my website, the links are all there as well.
Okay, I'm writing some of the things you said in the comments so people can grab them. Wonderful. Oh, one of my friends who's a pediatrician said, "Go Peds." Thank you so much for your time today, Dr. Rubin. I've certainly learned a lot. Dr. Rubin is in the west suburbs of Chicago. She's right down the street. She's next door. So if you're in the Chicago area, you have a new baby, she comes to your house. She offers a home visit for breastfeeding. So please take advantage of this amazing opportunity that's readily available to you. If your OBGYN doesn't know, advocate for yourself. Tell her, prenatal consultation before you have your baby, postnatal consultation before you have your baby. So I think it's remarkable that you make that effort. You go to their homes and help these new moms. It's really a blessing. And I thank you for embarking on that journey.
Well, thank you. It's an honor to be able to kind of walk that journey through with people.
Yeah.
And I love it.
All right, wonderful. I hope you have a good rest of your day today. Don't work too hard. Same like an entrepreneur.
And thank you so much for me.
Absolutely. It was such a pleasure. Thank you.
All right. Bye-bye.
Take care. Bye-bye.
Bye-bye.